Did you know that your body gives signals a month or a few days before you have a stroke? Stroke is undoubtedly one of the biggest causes of death in the world. The strangest part of a stroke is that although the symptoms usually develop quickly, it can take hours or even days for a person to realize that something is wrong. A stroke is a medical emergency because the blood that your heart is pumping is failing to reach a part of your brain. That area of the brain will be starved of oxygen and nutrients, killing thousands of neurons per second. For some reason, cardiovascular diseases are increasing worldwide, especially among young people. There are some warnings that you should never ignore, no matter how insignificant they may seem. Many signs that occur a month before are subtle, and many people ignore or confuse them with something else. The most important thing is that you know how to recognize them. If you feel any of these signs that you are going to see in this video, see a doctor as soon as possible because they could be signs that a stroke is about to happen. Today, you will find out the 13 signs that your body gives a month before a stroke and how to prevent this disease and get rid of this terrible statistic. 1. Persistently high pressure. If your blood pressure is not well controlled, it can greatly increase the risk of a stroke. Blood pressure is the force of blood against the walls of our arteries. If this pressure is high, it is called high blood pressure. This high pressure can damage blood vessels, and over time it can cause them to become narrower, weaker, and even rupture. If a blood vessel in the brain ruptures due to high blood pressure, bleeding can occur, resulting in a hemorrhagic stroke. If high blood pressure damages the arteries that supply blood to your brain, it can reduce blood flow and blockage and lead to an ischemic stroke. That's how important it is to know if you are hypertensive, and if you are, to treat it appropriately. Make a lifestyle change and take your medications correctly to control your blood pressure. This is essential to reduce the risk of stroke and other cardiovascular diseases. 2. Excessive fatigue. Excessive fatigue or extreme tiredness can be a symptom or warning sign before a stroke. Remember that fatigue can also have other causes. The fatigue related to stroke is intense and causes persistent tiredness, which may be atypical for you and is unrelated to physical exertion or lack of sleep. For example, excessive tiredness may be related to changes in blood flow to the brain. It could be caused by a narrowing of an artery due to atherosclerosis or a possible clot that interferes with the supply of oxygen. So if you are feeling unusually tired, see a doctor to be well evaluated. Sometimes, extreme fatigue can precede a transient ischemic attack, also known as a mini-stroke, a warning that there is a temporary problem with the blood supply to the brain. A transient ischemic attack is a transient condition that can be an indication that a stroke is about to happen. The symptoms are temporary, usually lasting a few minutes to a few hours, without causing permanent damage to the brain. Generally, an artery in the brain is blocked, but in less than 24 hours, the body itself manages to dissolve the clot in the brain, and the patient no longer has symptoms. But this is a strong indication that a stroke is about to happen to you. 3. Vision problems. If you have any sudden vision changes, it could be a warning sign of a stroke. Blurred vision, double vision, eye problems, and difficulty focusing may also be signs of brain circulatory damage. When vision loss occurs, it may be due to a blockage in one of the arteries that supply blood to the eye. Of course, there are other causes of vision problems. Even so, don't stop investigating what is happening. 4. Numbness or weakness in the extremities. Numbness or weakness in the extremities, especially on one side of the body, can be a warning sign before a stroke. This sudden numbness or weakness usually occurs in one part of the body, such as the arm or leg, or one side of the face. One side of the body may lose sensation. These symptoms usually only last a few minutes or hours, but they should never be ignored. Even if it is not a stroke, it could be a neurological problem that should always be investigated. 5. Speech problems. A person who is about to have a stroke may have sudden difficulty speaking. The speech may be slurred, and the person may have trouble saying the words or providing complete sentences. This is called aphasia, which is the difficulty in understanding, formulating, or expressing speech. 6. Sudden and intense headache. A sudden headache may precede a stroke. It is important to note that not all headaches are related to strokes and that not all strokes are preceded by a headache. In an ischemic stroke, headache occurs due to obstruction of blood flow to the brain. These pains, when they occur, are described as severe and sudden. In hemorrhagic stroke, which occurs when there is bleeding in the brain, the headaches are also intense and occur due to the bleeding. This type of headache is often described as the most painful. Sometimes, a severe headache can be a sign that an aneurysm is about to rupture in the brain. This is another thing to always keep an eye on. 7. Visual disturbances like flashing lights or sudden darkness. Known as transient vision loss or amaurosis fugax, this condition causes a temporary reduction or loss of vision like seeing shadows, flashes of light, or having part of your vision go dark. It usually lasts only a few minutes and then returns to normal, but it may indicate that one of the arteries supplying your eye or brain is partially blocked. 8. Dizziness or lightheadedness. Feeling dizzy, lightheaded, or like the room is spinning can be an early sign that something is wrong with your brain's blood supply. You may feel off balance, disoriented, or like you're about to faint, even if you're not tired or dehydrated. In some cases, dizziness may be related to a temporary blockage of blood flow in the brain, especially in the cerebellum, which controls coordination and balance. 9. Difficulty swallowing. If you suddenly begin to have trouble swallowing or feel like food is getting stuck in your throat, this could be a neurological warning. This happens when the brain's control over the muscles used for swallowing is affected. This symptom is often subtle and mistaken for something minor, but in the context of other signs, it may signal a possible stroke. 10. Mood changes, confusion, or unusual irritability. Some people who are about to have a stroke experience sudden mood swings, anxiety, or confusion. They may become unusually irritable or struggle to concentrate and make decisions. If you or someone you love suddenly seems emotionally different, especially if they seem disoriented, withdrawn, or out of character, don't ignore it. 11. Irregular heartbeat or heart palpitations. A stroke is often linked to heart problems, especially atrial fibrillation, a condition where the heart beats irregularly. If you feel your heart skipping, fluttering, or racing without reason, it could be a sign of an underlying problem that may lead to a stroke. Make sure to monitor your heart health and seek medical advice if you experience sudden or frequent palpitations. 12. Fainting or temporary loss of consciousness. Some people experience a brief loss of consciousness, feel like they blacked out for a few seconds, or have sudden moments of mental blankness. These episodes can be linked to a lack of oxygen in the brain due to a temporary blockage. Even if you recover quickly, don't ignore these signs. They could be mini strokes or precursors to something more serious. A quick reminder: think fast. When it comes to stroke, time is critical. Remember the acronym FAST. F. Face. Is one side drooping? A. Arms. Can the person raise both arms? S. Speech. Is their speech slurred or strange? T. Time. If you notice these signs, call emergency services immediately. Other neurological symptoms. Additional symptoms may include memory problems, poor coordination, nausea, vomiting, or general unsteadiness. These can appear days or even weeks before a stroke. However, similar symptoms may also occur with seizures, hypoglycemia, brain tumors, panic attacks, or central nervous system infections. That's why it's always important to consult a healthcare provider and get proper diagnostic testing. Final thoughts and prevention tips. Now you know, even small interruptions in blood flow to the brain can bring you one step closer to a stroke. Other risk factors that contribute to stroke include alcohol and drug abuse, obesity, poor diet, depression, anxiety, and a sedentary lifestyle. These factors quietly affect your body and increase the likelihood of stroke over time. Even more concerning, strokes don't always show warning signs before they strike. That's why prevention is the best protection. Here's how you can reduce your risk. Monitor and control your blood pressure. Keep your blood sugar in check. Exercise for at least 150 minutes per week. Eat fresh, whole foods and reduce processed items. Avoid excess sugar, salt, and saturated fats. Control your cholesterol levels. Stay up to date with medical checkups, especially with your cardiologist. If you found this video helpful, don't forget to like and subscribe to the channel. You can also help others protect their brain health by sharing this video. Until next time, take care and stay aware.